Welcome back to my channel. So, some exciting things are happening right now in healthcare in case we're sleeping or something like that. So, what I want to do is share with you how to get ready for the upcoming changes in healthcare in an orderly fashion so you're not hurting cats. Not, I don't mean hurt as in like, I mean like hurting like cattle. So you're not hurting cats. Um, so we are in healthcare are really good about having initiatives all the time, all day, every day. We have initiatives, but majority of initiatives fail. And when they fail, that's when they call a consultant to come in and pick up Humpty Dumpty, after all the king's horses and all the king's men had done whatever the heck they were doing to try to mitigate the issue. Here's what's going on though. Right now, we are witnessing one of the biggest shifts in healthcare history in the United States. What is happening is in chronic care, and I'm just giving you some context before I share my tools with you. In healthcare, chronic care is the most expensive care, or the most, they have like the most expensive conditions. When it comes to expenditure in healthcare. So chronic care, like things like heart failure, COPD, renal issues, musculoskeletal pain, depression, and anxiety, treating those are so costly that the government is taking chronic care from the fee-for-service treadmill, I like to call it, and transitioning them to value-based care where payments and reimbursement is aligned with patients feeling better. You get paid when the patient gets better, and that is literally what value-based care is meant to be about. So you're not fighting the system and swimming upstream the whole time. What's happening with maternal health, though, because maternal health seems to consistently get left behind when it comes to innovation, and that's for a number of reasons. We're not going to get into that right now. But when it comes to maternal health isn't on the fee-for-service treadmill per se. Maternal health is the way that people get paid in maternal health is by a global, we call it global obstetric billing. So all of your prenatal visits and your delivery and everything, one price tag that covers it all. What that price tag does that covers it all is, or what it doesn't do is it's not itemized. It's not fee for service. So what does not happen is you don't get the level of granular insight that having an itemized bill would do for you, right? So I guess the difference would be an itemized bill versus a bill that's not itemized. But here's a caveat. And again, I'm just painting the case study for you. I will show you some technology, don't worry. But what happens here is now obstetrics, gynecology, OB is stepping onto the fee-for-service treadmill that chronic care is leaving. Chronic care is leaving that, and it's going to take 10 years for it to completely exit. And maternal health is jumping on the treadmill. Now, there's a caveat to this. When it comes to that itemized bill, we use something called CPT codes. CPT codes allow a level of transparency into how things are done. It allows for attribution. It allows for a lot of things, but it's also fee for service. Now, going back, a lot of, let's say almost 50, let's just say like majority payer for births in this country is Medicaid. So you're dealing with FQHCs and organizations and entities like that. They are not, in my experience, they are not used to CPT coding at all. because it's been optional for them. They were using ICD-10s and whatnot. And I'm not trying to get too far into the weeds here, but there's an issue here. There's an opportunity, actually. I prefer to use the word opportunity instead of issue. The opportunity here is, for one, for those who were in the maternal health space to adopt CPT2 codes, right? So that's one, adoption of the CPT2 codes. Two, not only is it the adoption of those tiny CPT2 codes, but also training and awareness of the entire CPT system. Because last time I checked, when a person gets pregnant, they don't automatically lose diabetes. They don't automatically become normotensive. So you have CPT2 codes that pertain to general population and chronic diseases, right? And then you have ones that are specific to obstetrics that are new and that are kicking off January 1st next year. So there's an opportunity there to do both of those. But there is also a reason why chronic disease is leaving the fee-for-service treadmill. And we're on our way to where chronic disease is going right now, which is positive. I consider it positive, but I'm biased, you know. I like the idea of value-based care. But obstetrics is just getting to the point where we have an itemized bill. Anyway, that might all sound like Greek, and that's cool. One of the things that has happened as a result of this is phone's been ringing off the chain. Consultants are calling me going, hey, you know, we need to get ready for this change in billing for OB, because really, remember, healthcare is a business as well. And I'm not here trying to say, put your profits before you put your patients. No, I'm not saying that, because this whole time we know that I'm in favor of pay for performance, pay for when the patients get better, you get paid. The better the patient gets, the richer you are. That's how it should be. But anyway, money matters, because if you do not, by the deadline, adopt this new way of billing in obstetrics, you don't get paid, which means your clinic closes, shutters the door. So we have less than 6 months to make this happen. So instead of going out and consulting everybody, all the king's horses and all the king's men again, I'm going to share with you one of my secret weapons that I have found to be invaluable when it comes to, or priceless, let's say, when it comes to, hold on, it says that. Awesome. These are tools that I've built for myself personally, and I'm tweaking them and iterating on them to make them more accessible for other people. So I offer done for you services, obviously, and I also offer done with you services. This makes it possible. So I'm giving you a kind of a peek behind the veil so that you can do it yourself on some of these things, because we need to get moving, and we need to get moving, because I don't want any clinics to close, pretty much. So I believe in order and working smarter, not harder, and getting kicked off on the right foot if possible. So let me just give you a quick lay of the land. Where's my mouse? Okay. This is the lay of the land. Here on the left-hand side, we have the dashboard, which is what you're seeing right now. We have the agent swarm, which I'm not going into in this video. And the agents communicate with each other in the back end. Everything that you see is connected with each other. That's what I love. This right here is for charters, for goal setting, which is what I'm going to dive into extensively during in this time. This one right here is for roles, racing matrix, if you're familiar with that. failure fix. This right here is to help you identify, it's an FMEA. It helps you identify preemptively issues that can occur so you can mitigate them, address them before it's too late and you're not flying blind. Cause cure, this is root cause analysis, basic, but I added the, hold on, sorry, my charger. But I added the FMEA version that I love the best to this one. And then, of course, we have value stream mapping, we have planning, we have cycles and whatnot. But I'm going to focus on the goal guide this time. So each thing that you see here on the left, these are one of my trusted applications, right? And these are outside of the agent swarm. So these are just applications, but with the applications in the back end, they're streamlined to where when you put information in one place, it can feed into another place and help inform what's going on the other side. And then on top of that, we have these wonderful agents that are able to glean insights from each of these applications as well. Because again, I mean, I'm not going to say I'm lazy, but because again, I think that it's important to use technology to the best of your ability and use that to break down silos in whatever the heck it is. Okay. But they communicate. That is another reason why I think that SMART or smarter goals are a huge deal. What SMART goals do is, first, let me break down the acronym. Specific, S. M, measurable. A, attainable. R, relevant. T, time bound. E, evaluated. And R, readjusted. You can see that clearly here. I did my best to give as much explainability, as you would say, to this experience here so that if you have questions, you can check this out. Now we have different views here because people are different. Teams are different, right? Everyone is unique. Every individual on this planet is an individual, which means that you are unique and there's unique context for each person's story and reality and experience. And on top of that, it's dynamic. Last time I checked, you're still here and time goes on, right? So it's dynamic. Same thing for organizations, same things for teams, same things for groups. Every group is unique because it has so many moving parts and contexts and whatnot. In order for a team or a group to move forward with their mission, and in this case, the mission, should you choose to accept it, which you don't have a choice, right, is to change how billing is done so that you can actually get paid and keep the doors of your clinic open, right? It requires succinct communication. What this does is, right here, see, down here, pro tip, a well-written smarter goal should be understandable to anyone, any one of your stakeholders, including someone who just joined the team today. Now, that pertains mostly here because when you're done with your smarter goal, I have kind of like a Mad Libs version of this thing. And all of these versions right here, the classic form feeds into the project coach, feeds into the narrative, feeds into the canvas, feeds into the brain dump. And actually, I love when my brain dump feeds. I typically start with brain dump, but that's just me personally, but I wanted to make this very, very clear to you guys. You have tooltips here. So if you have questions about what does specific mean, you can see it here and it's also over here. Okay. But you become more succinct with your communication because time is of the essence. I would call this a dang nab sprint. We are sprinting to the finish line here when it comes to this major change. Last time I checked, for collaboration to happen, or the quality of collaboration depends on the quality of communication. I can't think of a single relationship, group, whatever, that can succeed and have high quality outcomes without communication. This right here is the bare minimum, the bedrock of, like, if you have a team and you don't know what your goal is, and your goal is poor quality, you're not going to make it. I'm not saying it has to be done this way, but this is how I like to make sure that my goals are, they make sense and I can easily communicate them, and that my goals are robust and inclusive. So here we go. So this is the classic form. I'm going to ignore this for a minute. Project coach, this right here is, you just have, it's just going to ask you questions and you answer them, and it will output your goal draft. Narrative, this is the Mad Lib style, which I love, because this right here becomes like the thesis of your goal. It becomes your thesis. And then as I type in here, see, it comes down here. So then I'm able to, in real time, see what's going on. And then let me delete that because this will flow into the other ones. I have my canvas. My canvas is one of my favorites. My favorites. Actually, I prefer the classic form, but my canvas is one of my favorites because what I can do is brainstorm with other people, brainstorm with teams in real time. I can do this virtually. I prefer whiteboard and marker. Let's just pause for a moment. Let's just pause for a moment and appreciate the yumminess of a good whiteboard and dry erase marker. But this is the next thing, right? Because I don't have those resources with me. I have my laptop, and actually, this is accessible by phone as well. It's a mobile application as well. Anyway, but I can, different targets, we can brainstorm, da, 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 da. Same thing with the metric that we're going to use to define success and track progress, why it's possible. So that's the attainable part, the deadline. So that's the time part, and the obstacles. These obstacles, as you can probably guess, ding, 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 flow into your failure fix as well, so that it helps you mitigate and address issues ahead of time. So quickly here, what I did was start with my favorite, brain dump. So with all of these tools, it gives you a high level of what the tool does, or why, or how it works. And that's just like without technology. Smarter goals. So you can take this and make a smart goal just here based off of that. This tells you about how the brain dump works. In brain dump mode, you just copy and paste raw notes and blah, 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 blah. I don't have to copy and paste because I have this connected with Zoom. So my transcripts flow directly into the brain dump, and I just manipulate the output, and I'm so happy about that. For those who don't have that connected, you have the option of copying and pasting your raw notes, your output from your AI chats or whatever it is. I'm just using this transition, this time-based transition, as a case study. And so what I've done is gotten ready. Bam, baby. Oh, hey, there we go. So I'm going to dump this into brain dump so I can show you how this works and how this flows into other parts of this application, the Goal Guide application, and how it allows you to further develop that SMART goal. So I'm going to start brain dump. Again, it says right here, dump everything in here. What I love about this as well is it will, because initially I was I was doing one goal at a time, and I found that when I put in my transcripts, I was, picking out the goal, or it would just detect one goal. I didn't give it the ability to detect multiple goals and parse those goals out. But in the real world, this is what happens when we go to be specific. To be specific, you're zeroing in on something. You find that there are certain things that are outside or in the peripheral, or subsets, or just dependencies on what you're doing. So there we go. So I put in my input. I did my brain dump with just the document here that I made really quick, harping on stuff. And it is not complete. And you'll see what I mean in a hot second. Before we move on, I want to show you the 3 goals that it detected. Okay. So it detected that transition. So what does it take? You have to transition your billing department from global bundle billing to this fee for service billing. You have to. What's the other thing that you got to do? Right here, and you have to implement and automate the capture of these codes within the EHR, right? And maintain eligibility to value-based incentives, right? Because again, fee for service is the treadmill that chronic care left. So we're stepping onto that. So if we want to make sure that we're incentivizing high quality care, we have to make sure that we stick true to this value-based care incentive part. And then last but not least, it said, revise clinical documentation standards to support medical decision-making and time-based coding complexity. Yes. So first and foremost, it says, you got to do this, you got to do this, you got to do this. I'm surprised with the output, to be honest with you, because I expected this to say, we have short-term, we have immediate, we also have long-term. So it might, I'm not sure exactly what I did there for this to say short term, and I'm very, very, very surprised. So I will tweak the parameters in the back end. And what I would do there is actually put in a feedback or a bug for what's going on here. If you see that something happens here on the screen and you're just like, Lauren, what are you thinking? Hit this thing right here, hit the feedback in the bug report. You can say UI suggestions, so that's like something that you see visually. Feature requests, this is something that you want added to this suite or whatever app you're in. Bug is something's not right. You type your thing, and yeah. And this right here lets me know exactly what part of the, I guess you would say, platform your bug pertains to. So I get that context. But Lauren, personally, I get every single bug report back so I can take a look at that. So yeah, I would consider that a bug, to be honest with you. But that's just because I'm me. Moving on. Take a look at this. It lets you know what the impact is, right? It lets you know what the effort is. And this is based off of whatever information this AI has. Is based off of the information this AI has. Now, if you have information in which you wouldn't yet, under role and rules or failure fix or cause cure or anything like that, that will and can flow back and forth into this. Also made these hoverable for you guys so that if you hover over impact, it will tell you why it rated this as high impact, why this was rated as high effort. It will eventually, it's not doing it just yet, but it will eventually let you know where it's pulling these insights from your input. So it will tag or source your input and tell you where it got that from. This is a different version of, because yeah, mine is like really customized to how my brain works. So that will be coming up shortly. Okay, so as you can see here, these are the goals that it came up with. This is not a SMART goal. And we are expected to develop these. Again, when we're using AI, we check one, of course, but two, when we're dealing with teams, it's very important to have the input of your team. You as a team, as a group, you develop and you share nuances, you share context to improve the quality of your goal. And you'll see a little bit more here. So I'm going to just save these guys. And this right here is from an earlier video. But let's go here. So transition the billing department from legacy global billing to itemized service-based EM coding structure by January 1st, 2027. I don't like that goal, so I've refined it quite a bit, and this is what it ended up looking like. I'll show you what that looks like later on, but first let me get back over here. So I'm going to choose this guy right here, and I'm going to choose this guy right here. Hold on, let me go back to the backlog. Give me 1 second, guys, because I want to go back to where I develop it. Let me go back. Excuse me. Now, I want to develop this guy. I'm gonna have to run it again. On hold. Let me go. Toggle off. All right. You know what? For the interest of time, let me just do the brain dump again. That's a bug that I will definitely put in there, because I want you to see what it looks like when you're developing. Okay, cool. Decision making total time rather than visit counts. Okay, cool. Because this pertains to CPT2 coding. Notice that this says immediate. This one says immediate. This one says short term. So it is showing you that. That's awesome. It will show you the impact and it will show you effort as well, as you already saw. I'm going to make it to where you can see how it is developed. And I will actually add another button to the work on section. You'll see what I mean. So this is where it gets exciting. So we have the goal guide here, and I'm under the classic form. So from brain dump, when I click develop, it will send me right back here to the classic form. What we've done here is made sure that we can see clearly what we're missing in our smarter goal. So first and foremost, right here, we have master and implement EM level section rules based on medical decision making or total time rather than visit counts, because visit counts they went into the global billing. So measurable. Let's just keep it simple. I'm just going to type any old thing. For this, I will say, master implement EM levels. Let's say 100% proficiency. Okay, I'm just going to give you a scenario, right? So you're dealing with clinical staff, and you're also dealing with people in your billing and coding department. For this example, I'm just going to say you have 5 people in your billing and coding department, right? And we need to get them to where they master those rules on medical decision making and well, billing and coding, right? So I'm going to say my goal to be measurable will be 5 out of 5 billers achieve. I can't spell, y'all. Well, I can. No, I can't. 5 out of 5 billers achieve 100%. Or no, no, no. Let's be realistic. 75% proficiency. Oh my gosh. Proficient, sir. Evidenced by. My goodness, y'all. I'm actually typing on top of a tuffet. That's where my computer is. Proficiency evidenced by 75%. Competency scores. Competency scores. And you'll see what that means in here in a hot second. Achievable. If you're wondering if it's achievable, or what achievable means, feel free to just hover over here. Confirm it is realistic given resources. So what resources do we have to make this goal work? What are the levers that we can pull? What is in our arsenal? What's in our goodie bag? What can we do? Well, what we can do is we can use motivational interviewing. We can have assessments or competency assessments. Actually, no, I'll put that under measure. I'll put that later on. We can use motivational interviewing. We can use a bespoke learning management system. We can hire a CPHQ. We can use train the trainer. We can use positive reinforcement. The list goes on and on. What do you have in your arsenal to make this possible, to meet this goal? Okay. Relevant. Is this relevant? Yes. Remember, your clinic is a business. This deals with billing, money, reimbursement for the services that you offer. This determines if your doors stay open or if they shutter and close, right? So this is extremely important. Caveat, really quick. Another reason this is extremely important. Recently, we have learned that it's being proposed that remote patient monitoring by third-party vendors might be going away. And that's in the chronic care space. So that's Medicare, right? Now, we have to ask ourselves why that is. When I dig and I dig and I dig, you don't have to dig very far. We learn that this right here is the reason why. This right here is the reason why they're getting rid of it, because this wasn't being done effectively, honestly, with integrity, actually. In the remote patient monitoring world, and for the sake of accountability and for accuracy, they're passing that responsibility to clinics like yours. Why? What does that have to do with me? Well, that's one of those bills that are outside of the global codes that I talked about, that we need to be aware of. And also, we don't want history to repeat itself. Like, if we can learn from the signals that we're getting in one area of healthcare, especially if they've gone before us, we're kind of standing on their shoulders, right? So we need to address that now. So that's another reason it's relevant. Time bound. Now, initially you saw that it said January 1st, 2026. I'm going to say, nah, that's way too soon. The latest I would push this out would be, let's say, the end of November. No, I wouldn't even say that. I would say November 1st. at noon CST. You know what I mean? Like, be specific about it. But it is definitely time bound. The reason why, right? You could put January 1st for a SMART goal, and you can walk out and be like, bam, sucker, did that. We good. Nah, not for this, because we are using smarter goals. Smarter goals give us an element of continuous, or give us an element of iteration. So here we go. How are we going to evaluate this? So that's first. How are we going to check on our progress? And just to cheat and jump ahead of myself, readjusted means, how am I going to calibrate or adjust, or what am I going to do if the evaluation is saying that we're headed in the wrong direction, we're not going to reach our goal by the actual deadline? Like, what are we going to do? So, evaluated, I'm saying that we can take our competency scores. So, we're going to track competency scores. Oh my gosh, this is so embarrassing. We track competency scores. We can track engagement. Actually, no. Let's just keep it numbers. Competency scores, because our learning management system is going to give us a score. What else are we going to do? We're going to have alerts in there so that we're not learning of this at the very end. If we add real-time alerts or triggers or whatever, or and this will be real time, because you want to know real time. You want to be able to look up and be like, bam, okay, this is where we are. Don't wait. Like, y'all, come on now. Come on. Don't wait until the end to see where you are. Like, you need to know where you, just like, it's the difference between, mom, I will text you when I arrive, and mom, here's the link. I'm sharing my location with you. You can see where I am in relation to where I started and where I am going. It's that different, right? So yeah. So competency score, learning thresholds for real time. And then we also want to know how many, right? Because we said 5 out of 5 billers. So we're gonna say what's the word? What's the word I'm looking for? Is it composition? No, not volume. Whatever. Let's just say number of billers. X out of 5. Where's my slash? 5. Okay. So we have that going on. Competency score, blah, 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 blah. And then what are we going to do if we have to readjust, right? So say our competency scores are going in the wrong direction, or they're stagnant, or whatever the heck. Like, say, and it doesn't have to be competency scores. We can say whether or not you are able to perform teach back and do a perform a train the trainer with an AI. It can literally be a custom GPT. Can you do a train the trainer with a custom GPT, right? And what score will that custom GPT or whatever application, whatever, give you? You need something concrete. But yeah, when you readjust, you have other levers. This means that you have other levers in your arsenal that you can nab and pull and move so that you can make this work. So I like to go back to achievable to see what's working, what isn't working. Attribution isn't the easiest thing in the world, without to be honest with you, it's not the easiest thing in the world without, learning that tacit knowledge and whatnot. But anyway, so what can we do? We can bring in additional trainers. No, not recruit, hire. Or no, deploy. Deploy tutors, right? We can find a way of incentivizing learning, right? So yeah, incentivizing. And we'll just put the money sign on there. Money, right? Making sure that people get a bonus for the unearthing of of how they did things. And anyway, but yeah, I think that's far enough for now. So what I already have is an agent that is able to grasp this big picture and actually assess the quality of the input in each of these fields. But on top, for the sake of this, bam, look, smarter. Let me get rid of this so you can see what happens. See? But when I put it there, bam. All right. And that's what we want. We want the goals to be smarter. I'm not saying perfect, but smarter. And then you come down here and you click save. And then you can always add another goal in here if you want, and blah, blah, blah. So what I love about this is this is an example of another one that I had, but this right here is the new one. Train clinical staff on the rules, documentation standards. No, was that it? No, it was this one right here. Master and implement EM level section, selection results, blah, 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 blah. And I decide that I want to work on it. So I can work on this goal. So I click it, it turns active, right? And I can click work on. And I can continue to develop, and I can continue to develop this goal, if that makes sense. So it's already saved to the global state. We have a robust goal. We can also learn more about this goal with the drop down. Bam, check that out. See? So we have the beginning of this. Master and implement EM level, blah, 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 decision-making tool over time rather than visit counts, right? We see that this is a developed goal. It's green. We are active right now. We can hit backlog if we want. We can put on hold if we want, but that would be insane. I don't know why anyone would do that right now. That'd be insane. You can hit completed, but I'm not going to hit completed because yeah, that will change everything. So let's hit that. Let's put it on as active. And then I hit it as active, and then now we have our goal. Now let's listen to it. Let's see what it sounds like. Let's see how well we can explain this, how succinctly, right? What are we going to do? We're going to get the stakeholders that need to be up to speed on how to bill, right? We're going to use motivational interviewing. We're going to use a learning management system. We're going to hire someone like moi. We're going to use train the trainer and positive reinforcement. Why? Because we have to do this because billing is changing. That's how it is. How are we going to know if we reach our goal? We're going to have competency scores, learning threshold alerts, real-time alerts, and we're going to evaluate each and every one of the billers individually and make sure that each and every one of the billers go through this training. And what do we do if we're going in the wrong direction? We're going to deploy tutors, right? And we're going to incentivize learning. So we're going to pay to make that happen. So that's that. That is Goal Guide in a wrap. I have a number of other goals in here. Like, remember, we generated like 3 or whatever. they're here and they automatically go, on hold until they are activated to be worked on. This one was one that I did earlier that I absolutely love. See? Same thing. Look at that. You don't have to reinvent the wheel. You don't have to reinvent the wheel. See, transition to counting, justifying, see. But at least that's where you get a starting point. Like that is where you start. You can't you can't go anywhere without that. That's where you start. In another video, I'll probably do another video next week. I will show you how this information flows into Agent Swarm. And I will also show you how Goal Guide populates in advance to role rules. I'll show you all of these right here. And I will definitely show you the score sense. Score sense, there's a star next to it because I'm just obsessed. I'm obsessed with it. Score sense is my way of aligning the incentives. So let me get on my high horse real quick before I say goodbye to y'all. Score sense. Actually, I'll show you. I'll give you a sneak peek. Did I hit save? I don't want to reveal too much. So I'm going to put all of these on hold. On hold. Okay, cool. Let me go to Score Sense just because. Score Sense. Woo, woo, woo. This is the balanced scorecard, but it is aligned with the IHI's quintuple aim. I'm a huge fan of the IHI and their quintuple aim. It used to be the triple aim, but it's the quintuple aim. A lot of times we hear people say, pay the people. Hold on, sorry. Sorry, saying that my stream is, there we go. I'm back. You got to care for the people that care for the people. So they're saying that you have to take care of provider experience as well. So employees, care team members, like if we're grumpy and we're burnt out, you're probably not going to give good care. You know what I mean? But the IHI took it a step further. They were just like, okay, patient experience, yes. Provider experience, yes. Cost, because we are hemorrhaging money in healthcare, not for long. If the cost is exorbitant and it's just sky high and our costs are not controlled, then it's going to compromise care. There's also population health. So the good of the entire cohort, the good of the population, the good of the community. So, and that is different than patient experience because patient is one person or one family. Community is the whole. And actually, I'm not even going to go there. And then last but not least, one of my favorite ones right here. Bam, baby. Health equity. Health equity. So how well are we reaching those who are in the margins? When all of these, and I'll probably do another video on it, when all of these are aligned and you and the aim, when they are aligned with money, when they're aligned with reimbursement, then all of a sudden everything gets better. When we incentivize betterment in these areas, all of a sudden we have improvement in all these areas. All of a sudden we have better outcomes for our communities, right? We have lower costs or better, better management of cost. We have better provider experience. We have better patient experience. And all of a sudden our disparities start to disappear. we have more equitable care. So I'll probably harp on this part later on so that y'all can see how everything feeds into this and how the agents work in the background of this as well. It is already detecting that there are some goals that need to be pulled over, and I will show you that in another video. Again, feedback bug, please and thank you. And then of course the quality co-pilot, which is I'll share during, oh my gosh, I'm not even sharing screen. I'm so sorry. And of course, the quality co-pilot, which I will share when I share the agent swarm. If you have any questions, comments, concerns, please do reply or whatever. You can message on YouTube. That's new. I didn't know that. Message me on YouTube. I will get back to you. I will read it. And you can drop comments or whatever you want to do. I think that I chose this case study for a reason. And that reason is I want folks to thrive. I want you to thrive. I want your clinic to thrive for the benefit of your community, for the benefit of your patients, and for your well-being as well. If we can do this, we can get in front of this, we can be effective if we're smart about it and we work smarter and not just spin our wheels and work harder. Anyway, thanks. Feel free to like, share, subscribe, and I will catch you on the other side.